Good morning. My name is Dr. Shebi Henda. I'm from Ministry of Health of Tunisia. Thank you for ISDIR for this opportunity to present my health policy in Ministry of Health of Tunisia in disaster preparedness. This is a small introduction, donc we don't need to detail much more. Tunisia is a small country in the north of Africa, neighboring Algeria and Libya. This is a small card for disaster main hazard in my country, chemical, floods, forest fire and some earthquakes. Some past events in Tunisia, some earthquakes in the last time, floods are the major events, and some other events like bombardment, crash plane, train crash, and some deaths and injury. The more events, the most often events are floods and forest fire, and road traffic accident is very serious one. This is this is in Tunisia, Tunis city, floods in 2003 and forest fire. Legislation, we have a small legislation in this area, one law and one decree. Partners in disaster management, the Ministry of Interior is and we have many departments, Ministry of Health taking part in this area. For disaster preparedness, Tunisia, Ministry of Health of Tunisia is engaged in this process with partners to promote this area. In Ministry of Health, we begin some realization like emergency unit department in which I'm working since 1997, and we have strategy of emergency sector development since 1998. We have National Committee for Emergency in this time, and we set up a Strategic Health Operation Center in the Ministry of Health since 2009. The axis of the strategy, we have the national strategy, hospital preparedness for mass casualty. We work on medical transportation, education and public awareness, and the last creation, the shock room. The national strategy with three axes: pre-hospital, the hospital emergency, and training in emergency department. In pre-hospital, we have the French system, pre-hospital team or first responder team. We set up 6 SAMU, or pre-hospital team, in many governorates in the north, in the northeast, and in the south, covering the majority of governorate with 17 SMU. We develop communication with technology communication, and the medical transportation are renewed with many steps. We hope to have one SMU in each governorate in 2030. The hospital preparedness, we have 182 emergency departments with different level, third, second and first level. We have many buildings, a new building like Trauma and Burn Center, the first one in 2008 and the second one by the end of 2011. And for training emergency medicine, we have in university a specialty in emergency medicine for paramedics since 2002, and medical specialty in emergency medicine since 2005. And we have many trainings with international agencies. For hospital preparedness, we began hospital preparedness since 2002 circular, and many training courses in this field, and we established data collection for hospital existing equipment and activities of health workers, and many blood banks and drugs in many governorates. We hope to have one by governorate. This is a real example for mass casualty in bombardment in one area, Jerba, in 2002. This is a training course for mass casualty. For medical transportation, we have many structures to make this service, private fire services, protection, civil protection, and the military. Some picture. And education for public awareness is done with many organisms, Ministry of Health, Ministry of Interior, Civil Protection, NGOs, and we hope to have the same program for every year. For the Shukro, the Strategic Health Operation Center is the newborn in our Ministry of Health in collaboration with WHO. This center to ensure real-time reception and management of health alerts, and to ensure information and exchange coordination between partners and other ministries. Actually, we have the refugee situation in the border of Libya. We would show some example picture. For next step, this strategy hopes to enhance the capacity of Ministry of Health to face emergency situation by updating disaster laws, provide more training to health workers, developing public awareness, and more collaboration between the actors. The shock room will be able not only to support the national health response, but also to help reduce risks and integrate the international security chain. This is some picture for actual situation in Tunisian border, Libyan border since 20 February 2011. More than 70 nationalities are fleeing Libya to Tunisia, and Tunisia, which was neither accustomed with this situation. We managed by military in first step, military camp and hospital field. This is the hospital field. The next step, NGOs, Red Crescent, Tunisia, with the camp. Oh, sorry. This is the camp of Red Cross and logistics. Local and regional health support. The camp. By the next step, international support, organization and NGOs. This is national coordination for medical transportation of injury. This is yes, medical transportation for injury to regional hospital. This is the civil protection ambulance, health ambulance, and military security. This is the hospital mass casualty and coordination with international NGOs and organizations. The current system is already functional and has proven its efficiency, demonstrated many strong points, and has attracted the admiration of and the gratitude of national and international community. It also has some weakness and shows certain signs of fatigue. It is therefore essential to maintain and strengthening it, to compensate for its weakness by taking stocks of lessons learned during this first phase and more supporting for the next phases. In Tunisia, the health care system is a priority. Significant investment in this area is stated. Disaster management needs more collaboration between the actors in this field, and well drawn up and organized plan will increase disaster response. Thank you for your attention.